I think this is really the change that investors need to make is thinking about human health and food as health as strategic infrastructure and not as a separate play. Because when you really think about it as strategic infrastructure across, some of the things that you brought up earlier, national security and the bond market, focusing in on the bond market, you're seeing a massive growth in the US healthcare spending. It was $5.3 trillion in 2024, and it's going to add effectively another 3.3 trillion by 2033. You're not seeing the population fundamentally become healthier. In fact, you're seeing declines in longevity and significant growing rates of disease and cancer. And when you really think about it against the bond market, you know, that increase in expenditure is going to force government to raise more, or, to raise more capital in some form or fashion. And when you think about it on the consumer level, the number one leading cause for personal bankruptcy in the US is loss of a job and loss of income. The second is being unable to actually pay your healthcare expenses. So you see it both on a, you know, very large federal macro level, but you also see it on a consumer level. Um, and I think, food is health in the form and fashion that we're talking about it starts to, build the ability for cost avoidance and increase the health of the population and start to, chip away at some of those fundamental structural issues. But I think the underpinnings that you have to think about it as a strategic infrastructure.